Hi, my name is Aubree, and I am a third-year doctoral student at Wright State School of Professional Psychology. Today, I will be discussing my non-empirical research of advocacy for an integrative and holistic approach to endometriosis. Please scan the QR code for a link to my full professional research poster. Research states that endometriosis is a common gynecological disorder that impacts around 6 to 10% of women in the United States. However, this rate is growing, and as we will discuss later, there is a delay in diagnosis, so therefore these rates may and most likely are higher than 6 to 10%. According to research, endometriosis is a disorder that is defined by endometrial glands and stroma that grow outside of the uterus. It's also associated with cysts that are called endometriomas that form on the ovaries with scar tissue, which often causes infertility and other painful difficulties, which impacts a woman's ability to function in her daily activities. Endometriosis is associated with chronic pelvic pain, painful sexual intercourse, and painful periods. Women often experience this delay in diagnosis that commonly takes up to 10 years because the symptoms experienced overlap with various other disorders and are often initially misdiagnosed. Historically, the gold standard for treatment for endometriosis primarily utilizes the medical model, and it includes medical procedures, hormonal treatment, and pain medications. In severe cases, this includes fertility treatments that can cause an upwards of $40,000 or even a hysterectomy. It is important to note that many of the standard treatment options have various side effects that can continue to negatively impact the woman's quality of life, both psychologically and physically. In most treatments, the woman's physical quality of life is prioritized for treatment rather than considering the psychological side effects of a diagnosis of endometriosis. Even with surgical treatments, research shows that 30 to 50% of women experience endometriosis growth reoccurring following the surgery within 7 years and often require another surgical operation that is invasive. Hormonal treatment also leads to side effects such as hot flashes, weight gain, anxiety, depression, and often cannot be used while attempting to conceive, leaving women with the choice of prioritizing reproducing or pain relief. Women with endometriosis commonly experience psychological, educational, occupational, and interpersonal difficulties. Research highlights that 44% of women with endometriosis experienced a decrease in their mental health functioning, resulting in anxiety and depression diagnoses. Common reasons for this are uncertainty for future regarding pain and fertility, feelings of helplessness and hopelessness, and hormonal treatment side effects. Educationally, due to pain, 41% of women with endometriosis receiving an education reported experiencing difficulties concentrating on schoolwork and having to use sick leave frequently. Occupationally, 40% of women with endometriosis report that their career and education have been negatively impacted and overall experience a 60% decrease of productivity due to this pain. Lastly, interpersonally, women and their partners both endorse experiencing difficulties with intimacy, uncertainty, financial difficulties, and feelings of helplessness and anger towards the impact that this has on their relationship. Women also historically experience social isolation due to pain, having to cancel plans, a perceived sense that no one understands, fearful that they may lose friendships, and a significant decrease in attending social gatherings, all of which negatively impacts their quality of life. Of the little research that has been conducted utilizing a psychological approach to endometriosis, CBT, mindfulness, and a self-care emphasis to counseling have all been found efficacious in treating endometriosis-related difficulties. However, each tends to benefit a different area of quality of life. For example, CBT primarily has been beneficial in treating the woman's psychological related quality of life domains, whereas mindfulness techniques primarily aid in decreasing the endometriosis-related pain. The interventions used various approaches and techniques and have been found useful individually by targeting the different quality of life domains. They have also been found efficacious when used alongside medical treatment. Therefore, the takeaways of this presentation are that research indicates that integrating the interventions and emphasizing the possibility of a holistic approach may be most beneficial in attending to all quality of life domains simultaneously, and not just focusing on alleviating that physical pain, as we now know this is much more complex. Future policies should target couples who may be experiencing difficulties due to endometriosis and evaluating the efficacy of integrating and utilizing this holistic approach to treatment. And here are my references. Thank you so much and have a great rest of your day.